pleasure that I introduce you to Dr. Long-Sheng Lu, the Director of Cell Therapy Center from Taipei Medical University Hospital, who specialized in cancer cell therapy. The topic for this session is Precision Cancer Medicine in Action, TMUH Experience. Let's welcome Dr. Lu.
Hi, good morning, everyone. This is Dr. Lu from Taipei Medical University Hospital. I'm very happy to share our experiences with tumor avatar-assisted precision cancer medicine during the past 3.5 years. Currently, cancers are being treated with guideline-based recommendations. Those guidelines are derived from population-level evidence. They are purely empirical. Although highly efficient, but wide variety of cancer make it impossible for this one-size-fits-all approach to address the personalized need for cancer treatment. Therefore, I want to quote Dr. Blake Cady that to successfully treat cancer, biology is the king, but patient selection is the queen. Patient selection nowadays is made possible with all kinds of novel technologies. Because cancer is a disease of uncontrolled cell proliferation due to genetic alteration, and therefore decoding genomic alteration in cancer specimen provided a very powerful approach for us to do the patient selection job. But very frequently, there are too many genes that have been disclosed from tumor gene profiling, and those genetically driven therapeutic targets, we are in a long list that we need a better tool to help us decide what actually is possible for us to use these well-developed therapeutic agents to treat cancer patients. And nowadays, this is what we call personalized cancer medicine has an international consensus on an acceptable workflow. This workflow started from tumor sampling, and we analyze those tumor samples with whatever technologies that made possible by the nowadays technology. For example, we can profile the genetic component, we can profile gene expression profile, we can analyze chromatin modification with methylation-specific sequencing, and we can profile genetic vulnerability of specific cancer type with patient-derived tumors. Those patient-derived tumors can be assessed in a test tube or can be assessed in a mice xenograft model. Those data will be analyzed via artificial intelligence and database search, and the final suggested recommendations will be reviewed and discussed by a group of experts. That's called molecular tumor board. And we implemented this molecular tumor board system in Taipei Medical University Hospital for almost 4 years. Very frequently, we encounter the situation I have shown here. There are too many genes to be considered for therapeutic actions than that is normally possible in the clinical context. So the question and the wishes of the treating physician will be, what would if we can have a tumor avatar that stands in the test tube so that we can treat those tumor avatars first before we can know the actual treatment responses in humans. With such technology, it will greatly enhance our capability to make sense of these genomic data and translate into actionable strategies. So this tumor avatar in our laboratory, we made it possible with circulating tumor cells. These cells are rare cells shedded from the primary tumor. They travel in the circulation, and among them, there are a fraction of elite tumor cells that is called cancer stem cells. They are able to migrate, they are able to form tumor clusters, and they are able to implant into distant new organs such as bone, liver, and brain, and causing a lot of troubles. In other words, circulating tumor cells and the circulating tumor stem cell within this fraction are actually the culprit for cancer progression, metastasis, and mortality. So, if we can use the technology, in this case we call them EvaSelect. This is a high-yield cell culture system that we can obtain these circulating tumor stem cells and then make them into tumor avatar in 4 weeks. And this is clinically feasible. We have tested more than 300 cases across 20 different tumor types. Those circulating tumor cell-derived organoids, or we call tumor avatar, is very similar to their original tumor. And in a representative case, we met a 51-year-old lady who suffered from recurrent aggressive fibromatosis. This is a rare soft tissue tumor that composed of abnormally proliferating fibroblasts. The standard treatment for this disease is surgery and radiation. Unfortunately, despite 2 surgery and 2 radiation therapies, disease still recurs in this lady and causes her great suffering because of her right hand nerve are completely damaged by the tumors. So we made tumor avatar from 10 cc of her blood and test the possible treatment option with the drugs. And we are very lucky to identify a drug, tamoxifen, that is very efficient in suppressing her tumor avatar's growth. Tamoxifen is a commonly used drug for patients with breast cancer. It is extremely safe and the cost is more than reasonable. And therefore, we started her on tamoxifen treatment. Immediately after a week, this lady started to smile. This is the first time I saw her smile during the treatment courses for 2 months. And then, day after day, I see her recover her function of right hand. And she started pick up her pen, she started to pick up a cup, then she started to use her right hand to write, to sign. And the pen was assessed by a rehabilitatory doctor, and there are objectively response of her daily function. Up to now, it's been 4.5 years. She still maintained on this medication, and the disease never came back again. So, with the tumor avatar, we found out a very unexpected treatment option for her that solved her long-lasting problem. And this is not the single case. During the past 3 years, we helped more than 40 patients, and tumor avatars gave a very good prediction with odds ratio 12.0. I think this is unheard of in the treatment of soft tissue sarcoma, which is a very difficult to treat disease. And with the early data like this, now we are helping patients with soft tissue sarcoma throughout the island with the technology. And collaborating with the enthusiastic physician network, we believe this tumor avatar technology is going to help us provide novel solution and better treatment outcome. Not only for this rare soft tissue sarcoma, we in our hospital, during the past 4 years, we also proved that circulating tumor cell-derived organoid or tumor avatars can help us predict treatment outcome in refractory pancreatic cancer and in difficult to treat rare pediatric brain tumors. So I think with these tumor avatars handy, we can collaborate with pharmaceutical industry to identify a better new drug without the need of very costly clinical studies. And that's what we did. We collaborate with a Taiwan local pharmaceutical industry, and we identified one of their planned active pharmaceutical ingredient actually is, instead of being a cytotoxic agent itself, is a very good chemotherapy sensitizer. And I believe this kind of approach, we put patient-derived materials or tumor avatars in the test tube, will allow convenient access for pharmaceutical industry to get their agent to be tested in real patients and real tumors. And the results will very likely be more reflective of the true conditions of the real human tumor and therefore increase the throughput rate of drug discovery. Now it is the age of avatar medicine. We are trying to derive tumor avatars with patient-derived materials. Those tools will help us embrace the new cancer treatment paradigm. That is precision, personalized, data-driven, and with a best possible outcome with whatever weapons we have against cancer. This is Dr. Lu from Taipei Medical University Hospital. Thank you for your attention, and I look forward to work with you to make this vision happen.